We underestimate a ton as far as clinical consideration today. While we despite everything get sick now and again, there is a scope of prescriptions and medications accessible. Our primary care physicians have a gigantic collection of information and experience to call upon, and we can as a rule depend on having current and clean offices. It wasn't generally similar to this. This rundown is to pay tribute to the entirety of the individuals who have improved the information and practice of medication. 1. Hippocrates of Cuz. 460 BC to 370 BC. 25,291,216 Hippocrates was a doctor in ancient Greece. He is thought by numerous individuals to be the father of Western medicine. He was an unbelievably groundbreaking man who created thoughts that were relatively revolutionary. He was straightforward in his conviction that disease was not brought about by the dismay of the divine beings, yet had real physical causes. He recognized that way of life, diet and ecological factors all influenced physical well-being. It sounds clear to us now, yet that is on the grounds that we have more than 2,000 years of his impact to thank. At the time this was a staggering conviction that addressed both the authority of the divine beings and different doctors of the time. At this point in history individuals didn't comprehend the interior functions of the human body similarly that we do now. It was an extraordinary untouchable to analyze the dead, so the anxious and circulatory frameworks had not been considered. The acknowledged hypothesis was that sickness was brought about by the four humors or various kinds of liquid that possessed the body being out of equalization. All medicines were recommended on this presumption, and Hippocrates himself trusted this. Hippocrates treated patients and showed his insight to other people. He had a devoted chasing after of individuals who helped treat others as per his standards and therefore expanded his prestige. He is credited with composing the Hippocratic corpus. This is an assortment of more than 70 records which portray the manifestations and movement of infections. This has been ignored during the time since his demise, and has educated clinical practice straight up to the present day. He put stock in the significance of watching the patient to see the movement and improvement of manifestations, and to audit how powerful the treatment was in battling these. He was additionally an organizer in the act of taking clinical and family ancestries from patients. These are standard practices for any doctor today, however they started with Hippocrates. Hippocrates is most likely most popular as the maker of the Hippocratic Oath. This is an announcement of good and expert moral guidelines that doctors were relied upon to comply with. This is as yet sworn on graduating clinical school in certain territories in a refreshed form. Point 2. Florence Songbird. 1820 to 1910. Florence Nightingale. Florence Nightingale is conceivably the most celebrated medical caretaker ever. She is known as the Lady with the Lamp. The realities that are thought about her are frequently covered in misrepresentation and legend. She was destined to a privileged British family, and was profoundly taught. She felt that she was called by God to turn into a medical caretaker, a move which her family felt was underneath her. She went to the Crimean front in Eastern Europe to tend to officers in 1854, where medical clinics had a horrifyingly high demise rate. At the time ailments, for example, cholera and typhoid fever were overflowing, with officers being multiple times bound to bite the dust after admission to medical clinic than they were on the combat zone. The significance of sanitation was not completely comprehended at that point, and patients were housed in grimy conditions, encompassed by the human misuse of those with irresistible sicknesses. It is broadly believed that she improved the cleanliness conditions in the emergency clinic during the war, causing the passing rate to drop. This isn't precise, or a case that she at any point made. Actually, the British government sent the Sanitation Commission to the zone. They cleared the sewage out of the military medical clinics, after which the death rates dropped. Nightingale was a gifted mathematician, with an energy for measurable investigation. She was the principal female individual from the Royal Statistical Society. Following her arrival from the Crimea, she did examination into the pace of death and what had influenced it, and discovered factual proof that it was the improvement of sanitation and tidiness that had rolled out the greatest improvements in improving the endurance rates. She utilized the certain factual information to campaign government officials and powerful board of trustees individuals, convincing them to roll out significant improvements to the clinic frameworks, both at home and for the military. She set up a medical caretaker preparing school in St. Thomas's Hospital in London in 1860. Before this, medical attendants had a poor notoriety of being harsh and rough ladies with small preparing, free ethics and normal tipsiness. It was not viewed as an appropriate calling for all-around raised women. Songbird schools had exacting guidelines about conduct and collectedness, and had an educational plan for understudy medical attendants to follow. They additionally stressed the significance of clinical preparing on wards. Songbird herself kept on composing reading material of medical caretaker training. Universal Nurses Day is as yet celebrated on her birthday consistently, 12th of May. The changes that she effected in social insurance caused a significant change in persistent consideration and medical caretaker preparing. These have majorly affected how clinical consideration is given today, and it is this degree of impact that has separated her from other medical caretaker trendsetters of the time. Point 3. Sir Archibald Macindoe. 1900 to 1960. Archibald Macindoe was a specialist from New Zealand. In 1938 he was made the advisor plastic specialist to the RAF. At the point when the Second World War began he wound up treating pilots who had been shot down during military activity. They were frequently awfully consumed because of the flying fuel lighting. Reconstructive plastic medical procedure was still in its earliest stages, and Macindoe was one of just 4 plastic specialists in the UK at the time. The ordinary strategies for utilizing corrosive to evacuate harmed skin and afterward holding up 2 months before attempting to perform medical procedure implied that the pilots needed to spend extensive stretches in anguish. It additionally brought about a lot of scar tissue. Macindoe chose to work promptly, removing harmed tissue so skin unions could be put straight away. This extraordinarily expanded the odds of mending, bringing about less scarring and substantially more versatility. He likewise grew new skin joint procedures which brought about lower contamination rates and increasingly fruitful unions. The men who were in his consideration got referred to as the guinea pig club, as the techniques Macindoe attempted were so groundbreaking. It isn't only the spearheading physical consideration that Macindoe gave which marks him as an uncommon man. He additionally perceived the unbelievable estimation of mental recovery for the servicemen who were in his consideration. It was regular for consumed casualties who had distorting wounds to evade the open eye. He felt that it was significant for them to remain some portion of their locale, and to have pride in what they had accomplished for their nations. A large number of the men were in emergency clinic for various years, having different reconstructive medical procedures, thus their nearby network turned out to be East Grinstead, where the consumes unit was. He urged them to wear their administration outfits rather than emergency clinic outfits, to keep up their expert pride, and he urged the network to draw in with and bolster them. It turned into a respect to have them over to their homes, and they went to film openings and occasions. This side of Macindoe's heritage has been delayed to get on, yet individuals are presently understanding the significance of keeping up help and mix for the individuals who have been harmed. Point 4. Sigmund Freud. 1856 to 1939. Sigmund Freud was an Austrian nervous system specialist and therapist, despite the fact that he is also called the father of psychoanalysis. He treated patients with crazy ailments and depression. At the time society, including the clinical foundation, was amazingly misogynist. Most of Freud's patients were ladies experiencing crazy sicknesses and anxiety. This included female unyieldingness. In spite of the fact that there are as yet a higher extent of ladies that experience the ill effects of tension-related side effects than men, the medications for them at the time could be extraordinary. One mainstream treatment was the utilization of an electrical vibrator to animate climax, as this was felt to be a reason for insanity. Remember that not these ladies will have been dealt with readily, especially those in the refuges of the time. This left numerous ladies in a position where they were treated for obstinacy and nervousness by restoratively endorsed assault. Different medications incorporate applying manure to the privates, leeches, arsenic treatment, and careful annihilation of the clitoris. Freud felt that these medicines were not powerful, and neglected to address the foundation of the issue. He was one of the first to consider that these sicknesses may have a mental, as opposed to physical reason. He built up a treatment which was incredible at that point, which essentially included tuning into the patient. He was a pioneer of the talking cure. He at first attempted mesmerizing, and later utilized his strategy for analysis. This includes investigating the emblematic significance of the patient's side effects and recollections to attempt to distinguish quelled recollections. He felt that in the event that they could be defied, the upsetting indications would stop. Freud was one of the primary individuals to deductively recognize that insane sicknesses could be because of horrible recollections which were repressed. Freud likewise evolved hypotheses about sexuality, and expressed that the improvement of a sound working individual was because of effective progress through phases of sexual turn of events. He gave us the possibility of the Oedipus complex. This is the place a male youngster considers his to be as his principal center and becomes hopelessly enamored with her. He feels undermined by the nearness and predominance of the dad and stresses that he might be emasculated. He portrayed a comparable stage in females, where the emphasis is on the dad, and he depicts penis envy, expressing that ladies feel inadequate because of the absence of this member. He likewise portrayed the oral, butt-centric and phallic phases of youth improvement, where the essential sexual desire is identified with every one of these three regions thusly. Freud felt that issues in advancing through these stages were the primary driver of depression and nervousness in grown-ups. His attention on imagery of dreams and discussion prompted the expression, Freudian slip, being authored, to mean a blunder in discourse which is representative of our actual wants or meaning. Although numerous individuals feel that Freud's hypotheses exaggerate sex, he additionally had a cultural effect in bringing the subject of sex and individual sexuality to the cutting edge. Remember that when Freud was building up his speculations, sex was not talked about in the manner in which it is presently, and Victorian qualities ruled. In spite of the fact that Freud's speculations were produced using a male point of view and have been generally reprimanded by women's activists, he himself recognized that the female viewpoint required further examination. At present, analysis is in decay, and isn't generally utilized as a treatment. It is, be that as it may, the antecedent for present-day mental treatment. Most by far of treatment of uneasiness-based disarranges is currently with verbal treatment, permitting individuals to talk about and investigate their issues and the purposes behind them. Preceding Freud, this would have been outlandish. He has permitted the zone of brain science and the related territory of psychiatry to progress significantly. His speculations have gotten broadly known outside of the clinical field, and have empowered the thought of brain research to get mainstream. This has had a tremendous effect in assisting with decreasing the shame of mental illness. 5. Marie Curie. 1867 to 1934. Pictures 2. Marie Curie was a Polish-conceived researcher, despite the fact that she moved to France to examine and remained there subsequent to meeting her better half. She explored and tried different things with radioactive substances, and imagined radioactivity. Her significant other, additionally a researcher, helped with her exploration, and in 1903 they were both granted the Nobel Prize in Material Science for their examination into the radiation wonder. Curie is the pioneer of both radium and polonium, and in 1911 she was granted the Nobel Prize for Science for her disclosures. She was the primary ladies to be granted a Nobel Prize, and was the main individual to win various Nobel Prizes. She remains the main lady to have won the honor twice. At the time, a significant part of the French government and Logical Foundation were exceptionally negative towards her on account of her sexual orientation, declining to recognize a female researcher among their ranks. Curie's exploration assisted with creating radiation as a helpful device. Curie's exploration distinguished that it can harm a focused on zone of the body, and could be helpful in treating carcinogenic tissue. This is as yet the establishment of radiotherapy today, in spite of the fact that the strategies have changed. At the time, she filled little glass tubes with radon, a radioactive gas, that could be embedded into the territory of the tumor, making it shrink. During World War I, Curie and her girl utilized their discoveries to help troopers harmed on the bleeding edges. They fitted X-beam machines to vehicles and drove them legitimately to handle clinics. They had the option to show the area of slugs, shrapnel or broken bones, and were an extraordinary help with giving proper clinical care. Unfortunately, at the time the hurtful impacts of working with radioactive materials were not known, and both Curie and her better half endured sick well-being because of their elevated levels of introduction. The two of them displayed wounds on their fingers from taking care of the materials legitimately, and Curie herself in the end kicked the bucket of leukemia. Her exploration notepads have such significant levels of radioactivity that it is as yet undependable to deal with them without defensive hardware. Belatedly, the French government guaranteed that both of the Curie's remaining parts are presently at the Panthéon in Paris. She is as of now the main lady to be there on her own legitimacy. The impact of radiotherapy, and later chemotherapy, and ongoing investigation into malignant growth and leukemia can't be overestimated. The aftereffect of Curie's work has spared endless lives. 6. James Blundell. 1791 to 1878. Superstock 1899 to 19,345. Blundell was a British obstetrician. At the time it was normal for ladies to bite the dust in labor. He thought about whether ladies who drained intensely subsequent to conceiving an offspring and generally kicked the bucket might have the option to be given another person's blood. He tested to figure out how to securely transfuse blood starting with one individual then onto the next. He concocted gear explicitly for this reason, some of which is still being used today. Prior to this, individuals had tried different things with orally taking care of blood to someone else, yet this had been fruitless. Tests were additionally made giving the blood of creatures to people. Some endure, in spite of the fact that apparently this was because of just accepting such modest quantities of the blood that they just had a minor hypersensitive reaction. Blundell distinguished that for a human to effectively get a blood transfusion of any huge amount and endure, it should have been from a human. He distinguished that blood that was put away would coagulate and understood that for his work to be effective the transfusions should have been made nearby. He in the long run played out the principle fruitful human blood transfusion from a spouse to his significant other when she began to discharge following the introduction of their child. Not the entirety of Blundell's patients endure, yet at the time they were likewise not mindful of blood composing and the issue of invulnerable dismissal. Investigation into this was done later and further developments have been made in this field, yet Blundell ought to be recognized for spearheading the human blood transfusion. In the UK alone there are at present 8,000 units of blood utilised day by day, and the World Health Organization reports that in 2007, 85.4 million units were gathered. Transfusions spare the lives of millions. Regardless of whether through mishap, medical procedure, or ceaseless ailment, individuals endure today who in any case would not have. 7. Joseph Lister 1827–1912. Joseph Lister was a British specialist and educator of medical procedure. He is known as the father of asepsis. At the time individuals didn't comprehend that germs exist, and what number of diseases are helped through the exchange of contaminated particles. They imagined that sickness was spread by miasmas, awful air, and utilized fragrant herbs and blossoms as a method of warding off ailment. Lister saw that a considerable lot of the individuals he worked on endure the medical procedure, however later passed on based on what were known as ward fevers. Actually the pace of death from post-employable disease at the time was huge. Around this time the principal inquire about was being done into microorganisms, and Lister knew about this. He recommended that the explanation behind post-usable contamination was that creatures were prospering in the injuries. He noticed that specialists frequently moved between various surgeries without washing their hands, managing tainted tissue before doing an intrusive strategy on another patient and bringing the disease into the wound. He chose to take a stab at utilizing carbolic corrosive as a disinfectant. He urged his specialists to wash their hands in an answer of it before medical procedure, and to wear clean gloves. He additionally utilized it on his careful gear, had associates shower an answer of it in the working performance center during medical procedure and utilized it to clean injuries and dressings. The pace of contamination fell significantly following the ramifications of these measures, and Lister had the option to impact others at an opportunity to recognize his techniques. Lister's discoveries are as yet applicable today. This is where enhancements in disinfection and asepsis began, and this is essential to consider in the period of MRSA and other emergency clinic-obtained contaminations. 8. Joseph Murray. Brought into the world 1919. Realistic 1. Joseph Murray was initially a plastic specialist. He worked on harmed World War II servicemen. He was routinely utilizing skin unions to fix harmed tissue, and got keen on the wonder of tissue dismissal. At that point, investigate was being done which demonstrated that there was an insusceptible reaction which caused dismissal. He pondered whether there was an approach to beat this and started his own examination into dismissal of tissue and organs. He chose to take a gander at the chance of a kidney transplant. At the time, an individual with kidney disappointment would not have had a lot of an opportunity. An endeavor had been made by a Ukrainian specialist during the 1930s to transplant a kidney, however the patient had kicked the bucket on account of the insusceptible framework dismissing the new organ. They expected to figure out how to check whether the activity should be possible without the invulnerable framework dismissing the new organ. In 1954, Richard Herrick required another kidney, and his indistinguishable twin sibling Ronald offered his. As the tissue of each twin was indistinguishable, the insusceptible reaction ought to be stayed away from. Murray and his group worked on the Herrick siblings, effectively transplanting a kidney with no dismissal. It was the main fruitful human organ transplant. Murray proceeded with his work in transplantation, later playing out the primary transplant from a random individual with immunosuppressant drugs. In 1990, Murray was respected, alongside E. Donald Thomas, with a Nobel Prize for medication for their work in organ and cell transplantation. 9. Alexander Fleming. 1881–1955. G1U28935 and Alexander Fleming. Alexander Fleming was a prestigious researcher and pharmacologist. He is otherwise called the father of antibiotics. He is credited with the clinical disclosure of penicillin. This was an unplanned disclosure. Fleming had a chaotic lab, and had neglected to take care of the entirety of the flu tests he had been taking a shot at before going on vacation. On his arrival, he found that shape had developed on a portion of the contaminated petri dishes. Where this form had come into contact with the flu societies, it had been demolished. Fleming did additionally examination into this sudden shape and found that it could securely be given without watching any evil impacts. The hypersensitivity responses that are now and then observed were not noted in these tests. Nonetheless, he found that it was hard to get enough of the penicillin to be powerful, and found that developing it for a bigger scope was exceptionally troublesome and tedious, so he didn't advance any further with it. 10 years after the fact, his exploration was preceded by Howard Florey and Ernst Chain at Oxford University. They found a strategy for mass-creating penicillin, and in 1944, after clinical preliminaries, got subsidizing from the US and UK governments to deliver it on a modern scale. The two governments were quick to have this wonder medicate accessible to troops battling in involved Europe, and in danger of disease from fight wounds. In 1945, Fleming, Florey and Chain were granted the Nobel Prize for Medication for the revelation and creation of penicillin. Prior to the disclosure of antitoxins as we probably am aware them today, there were hardly any compelling medicines for disease. Indeed, even a minor injury could turn into the site of a significant contamination that executed the patient. Arsenic and other harming and poisonous substances were utilized, however they made further harm the body. Individuals kicked the bucket and massive flu scourges, tuberculosis, red fever, meningitis, pneumonia, and diphtheria. Gonorrhea and syphilis were regular explicitly transmitted infections. These sicknesses can be deadly, and on the off chance that they are endure, can cause an extraordinary measure of constant harm. The revelation of penicillin and the improvement of new antitoxins throughout the years have permitted us to treat sicknesses that scourged mankind for centuries. They can in any case be not kidding on the off chance that they are gotten, yet now individuals get an opportunity of endurance that our predecessors didn't have. Premise player placeholder. 10. Edward Jenner. 1749–1823. Edward Jenner was a British specialist. He is viewed as the father of immunology. At the time there was no safeguard medication in the structure that would be perceived today. There was no immunization against disease, and scourge was overflowing, decimating entire networks. Smallpox was an especially harmful illness which was thought to have been shrunk by around 60% of the number of inhabitants in nations where it was endemic, executing around 20%. This cleared out entire networks, leaving millions dead consistently. There was, and still is, no known solution for smallpox, so the main expectation isn't to get it. It is the sickness liable for annihilating the Native American, Incan and Aztec populaces when colonized by Europeans. It was no respecter old enough or rank, clearing out sovereignty and ordinary citizens the same. It brings about fever, and a rash which changes into liquid-filled pustules. Individuals who got it were not expected to endure, and the individuals who did were scarred for life by the pustules. Survivors were likewise frequently left visually impaired. Individuals were so terrified of this infection that they attempted to immunize themselves against it by breathing in the scabs from smallpox bruises. Lamentably, this regularly led to the individual getting the out-and-out disease. In the middle of this, Jenner noticed that milkmaids who as often as possible got a less outrageous rendition of the ailment called cowpox, never appeared to get smallpox. Cowpox caused rankles on the skin, like smallpox, yet was not lethal. He guessed that cowpox may give the individual resistance to smallpox and, incredibly, figured out how to get a neighborhood rancher to permit him to give a trial a shot his child, James Phipps. In 1798, he emptied a few discharge from the rankles of a milkmaid with cowpox, and infused it into the arm of Phipps, and rehashed this over a couple of days. He at that point infused him with smallpox. Phipps got unwell, yet didn't grow out and out smallpox and recuperated inside a couple of days with no scarring or other sick effects. Jenner started inoculating local people, and consistently offered his immunization for nothing. He was resolute that he didn't need it to just be accessible to the rich. He drove forward to get his thoughts acknowledged, as there was a ton of insubordination, especially from the congregation, who felt that it conflicted with God to give infected creature material to people. As the quantity of individuals who had been inoculated expanded, the resistance got apparent, with individuals who were insured neglecting to get smallpox. His hypotheses were acknowledged, and inside 30 years it was made mandatory to have the immunization in England and Wales, and it was without given to all. Smallpox is currently a non-existent sickness, having been announced terminated by the World Health Organization in 1980. This was after a deliberate and overall immunization strategy. This harmful and savage sickness has been cleared out, after work that was begun by one man. In any case, it isn't simply smallpox that has been influenced. Routine immunization for major irresistible ailment has radically decreased the quantity of instances of measles, rubella, diphtheria, lockjaw, mumps, polio and meningitis. These ailments are possibly lethal, and cause constant and pulverizing impacts in the individuals who endure them. Jenner's work has enabled us to secure ourselves against contracting them. He is considered to have been at last answerable for sparing a larger number of lives than some other individual ever.